Hello everyone. We are back with another session of Hirad EP YouTube channel. So please subscribe. If you find these videos helpful, please like. And today what we're going to do, we're going to continue our review of Afib atrial fibrillation guidelines in 2023. This is going to be part 7. We're going to talk about two things. What is the best technique for pulmonary vein isolation or catheter ablation of atrial fibrillation? And second thing we're going to talk about is what happens if the patient comes back after ablation with atrial fibrillation. So what is the best approach? What should we do in that setting, and what are the data? So again, let's get into the business. Let's talk about it and discuss what do we have. All right, so let's talk about techniques for catheter ablation. So there are different ways we can treat the patient with atrial fibrillation when we do ablation. One of them is isolating the pulmonary veins. Another one is adding lines or going after area of scars or something called cafe. So there are a lot of different options that you can try to improve the outcome of atrial fibrillation ablation. Means you don't want to see Afib is back after your first catheter ablation. The only thing that shows solid evidence is pulmonary vein isolation only. And we don't have a good amount of data about other options, like adding lines in case of persistent atrial fibrillation, or getting rid of posterior wall of the left atrium, or modifying the substrate if there's a scar tissue somewhere here and there. So there are not solid data. There are some data favoring each one of them. Also, as an end outcome for your procedure. So for example, at the end of the procedure, you isolate the veins. What do you do? What is the best approach to make sure the pulmonary vein isolation is done appropriately? There are techniques like waiting period for 20 minutes, for 30 minutes. Some use adenosine to see if there's a reconnection between pulmonary veins and the left atrium. Also, there are some techniques using some other medication like isoproterenol or pacing type of different locations, or looking for triggers. So there are a lot of different ways of checking and waiting, and none of them showed significantly in better outcome with just isolation of pulmonary vein. And even the waiting period of 30 minutes didn't show strong evidence. So that's the only strategy that shows results, pulmonary vein isolation. And in patient undergoing Afib ablation, we noticed that comparing to the medication, we have a significant decrease in burden of atrial fibrillation. So catheter ablation is very, very effective, decrease significantly the burden of atrial fibrillation versus medication, and we don't have better approach than only isolating pulmonary vein. There are other things that we're under investigation. There's some data from like alcohol ablation in case of persistent atrial fibrillation, but still we need more data, and in the future we might have better outcomes. Now, in general, the success of or suppression of atrial fibrillation is significantly dependent on the substrate, also the left atrial size. One of the important things that we need to remember that almost 30%, in some cases up to 40% of the patient with the first ablation, they will come back with atrial fibrillation. In these patients, we have again two options. Number one, give rhythm medication. Number two, repeat catheter ablation. And they found repeat catheter ablation provides superior outcome comparing to rhythm medication only. And also, some of the patients also found benefit if they get rhythm medication just post-ablation. So the first couple months, 2 to 3 months post-ablation, we call it healing phase, and patients are prone to go back to atrial fibrillation. And there are some data, the evidence 2A, that these patients might benefit from short-term antiarrhythmic after catheter ablation to make sure during healing phase we don't see much of atrial fibrillation, because that shows decreased hospitalization significantly. So again, if you have recurrence of atrial fibrillation, you can start rhythm medication again, And surprise, surprise, rhythm medication works better now. Now that your first ablation, your medication also works better. If the medication is not good enough, or the patient still have a lot of symptoms or intolerant of the medication or doesn't want to take a medication, second ablation also can provide more relief and improves the outcome of catheter ablation. So sometimes patient needs multiple catheter ablation to get rid of or improve the burden of atrial fibrillation significantly. All right, so that was about, this one is like a little bit short one. And for now, I will say goodbye, and we'll see each other next week again. Thank you again.